Hello, welcome again to Miami Community Health. I'm Dr. Anthony Gonzalez, your host. We're here to talk about another important health topic. Now, today we have a topic that affects everyone, every single person. You know, sometimes we talk about some women's problems, sometimes men's problems, sometimes it's just particular diseases, but now we're going to talk about something that affects everyone. Now, this month and this week is Hand Washing Awareness Week. Washing your hands, making sure that you are maintaining cleanliness and decreasing contamination and germs is very important. I have read things that it could reduce diseases by 50%. We could save 1 million lives a year just by washing our hands. So we're going to learn a little bit about hand washing. We're going to learn about the history of hand washing. We're going to learn how we deal with infection control, both in your home as well as in the hospital. So I brought Gabby with us. Gabby Flores, welcome, Gabby.
Thank you for having me.
Gabby is our infection control manager at Baptist Hospital. She is an expert in not only hand washing, but infection control. So we've brought Gabby to talk to us and kind of educate us about hand washing. Welcome.
Thank you for having me.
All righty. So what does an infection control manager, infection control nurse does? What do you do?
Well, I want to know what you think I do also, because many people don't know what we do. So we track and trend hospital-acquired infections. We follow the CDC guidelines. We make sure the hospital knows what they need to do in order to keep the quality high and infections low. So we track and trend urinary tract infections as it relates to being in the hospital greater than 3 days, bloodstream infections, surgical site infections, C. difficile, and there's one more, MRSA bacteremia. So we trend those and we give the hospital feedback about how to improve on our rates. We're sort of a nose to tail department. We are heavily involved with construction. So if there's construction going on, let's say outside of the ICU, we make sure that it's contained and that it's not going to affect the patient population that it might be near. We also give surgeons feedback about their surgical site infections.
That's exactly what I think you do. I mean, I know what you do.
Sure.
What you do is you try to problem solve.
Yes, we're investigators.
Right. Yeah. If we are seeing that there is a trend of infections, we try to figure out, and you are the one that really is the leader that kind of puts it all down for us, and we try to figure out what is causing that. Is there something? Is there a missing link? Is there something happening that's causing that? So obviously you're very important because infections in the hospital can occur. They occur from the patients themselves, from the treatment that they can get. So it's very, very important. So of course I know what you do.
About 15% of patients will acquire a hospital-acquired infection in their stay. So our goal is to really reduce that, and through every effort, whether it's the environment, keeping it clean, whether it's monitoring hand washing, whether it's doing extensive rounds to try and figure out what's going on with a particular infection. We do see outbreaks from here to there, and it's our job to go in there and investigate.
Yeah, so that's very important. That's a very important point because I always tell patients you don't want to be in the hospital.
No.
Because, you can get something at the hospital. So people don't realize, I want to be here and you care for me here. No, it's a dangerous place to be. Obviously, you can get good care, but you can get an infection at the hospital.
Yeah, I'm happy you're saying that. I have even friends that are frequent flyers, and I say, if you can try and troubleshoot some of this at home, truly try to. You don't want to be admitted, and if you are, we want to make sure that you're holding your healthcare workers accountable. Hey, if you didn't see someone wash their hands, make sure you ask them to. It's really, really important. It can increase your length of stay. It increases mortality. So it's a hot topic for sure.
So talk to us about we're going to start off with hand washing, the history of hand washing.
Sure.
You sent me a video of how this all started and how babies were dying because of, tell us a story.
Sure. So it was less than 200 years ago, if you can believe that. It was like 1850s in Hungary. There was a physician that realized that the midwife freestanding facility, whatever it was, they had a much lower mortality rate. It was like less than 1% for their birth rates. And at the hospital he worked at, it was about 20%. And he just observed the physicians who were working in the morgue. Some of them would get nicked through the autopsies, and they'd go straight to deliver a baby. And then about 20% of moms would die. Some of them were terrified to deliver in the hospital. They would even try and have their babies at home if they could. And so he really studied that, and he shared, I think this has something to do with the morgue and not washing our hands in between. And people thought he was crazy, and he was admitted to an insane asylum. And he died
very young.
He died very young of sepsis. Ironically, the thing that he was trying to, and about, I think Lister, right after him, maybe 10 or 20, 30 years after, confirmed that that's what was happening. So, in general, medicine takes about 17 years to adopt a theory. And unfortunately for him, he was right. Apparently he was very timid and anxious sort of to share. A lot of people, because they thought he was crazy, and he's proven to be right. And it's the number one way to prevent disease.
Right.
Is hand hygiene.
So how has COVID, obviously hand washing was big for COVID. I remember, you have to sing happy birthday, right?
20 seconds.
When you're washing your hands. And so, everything from the washing the hands in COVID, the hand sanitizers, how did COVID change everything?
COVID was a blessing and a curse in a lot of ways. The blessing was that hygiene became the priority for a lot of people that otherwise thought it was just something that didn't really matter. I think everyone knows the word PPE now really well, whereas before it was just like, I don't know, what do I need to put on? So it's been great because the awareness is there. It's like the world got a super training on how to have better hygiene. But there's still a lot of opportunity. You'd be surprised. Going from patient to patient, or just not really understanding the concept or like the mode of transmission has been, I think we've gotten a little lax, but COVID really, really, got everybody to pay attention to how to use gloves properly or just do hand hygiene properly.
All right. So today in the hand hygiene and washing your hands, maybe we can give, our viewers some kind of tips and some advice about when I should be washing my hands.
Sure.
Of course, you can wash your hands every second of every day.
Yeah.
I actually have a friend.
We don't want you to do that.
No, we have a friend of mine. We have a friend of mine who we were talking before the show. Who he sees you, he shakes your hand, he runs and washes his hands, and then he gets out of the bathroom. He goes, "I just washed my hands. I can't shake your hands." How much? There's a little bit of an obsessive.
Yeah, we don't want you to be obsessive because your skin flora is also there to protect you. So if you wash some of that away, you can obviously have other problems like allergies or a lot of sensitivities to other things. So I think there's a balance. Absolutely. After using the restroom is like the gold standard, but even before, because you're touching a lot of things before, and then you're going to touch your own body. So I would say even before and after using the restroom, before eating a meal, after eating a meal, since you're also touching your mouth. And then door handles are a big one. So like if you're out in public for a while and it's probably time to wash your hands at some point. But I would say that if you washed your hands and it's been a few minutes and you're going to shake someone else's hand, it's okay to not wash your hands, just before that or after that. OCD is a real thing. And unfortunately, there are many people that did become really obsessive about it from COVID, and it probably didn't need to be, for sure.
And so is the hand sanitizer equivalent?
That's a good question.
People carry it.
Yeah.
I was with my son yesterday, and he's got it on a little thing around his neck, lanyard around his neck. So,
yeah, I like hand sanitizer for the same thing. I'm walking around. Maybe I'm at an amusement park with my family, or we're at a restaurant. It's great, but I would say hand soap and water is superior. It can take off gross, material. Sanitizer is good for when you're in a pinch, but hand washing is always the best.
So hand washing.
Friction is what kills the bug. It's not necessarily the material. So as long as you're rubbing really, you ever seen people put sanitizer in their hand and kind of
they wave it off.
Oh no, you don't want to do that. That means it's not working, right? So you gotta really rub until it's completely dry.
Okay.
That's how it works.
All right. So let's also educate the public about hospitals and hospital infections, and how do people know if the hospital they're going to is doing the right things like you guys do and we do at Baptist, and infection rates at the hospitals.
Sure.
How do they know that?
It's a little tricky. So in 2015, the mandates began with public reporting on hospital-acquired infections. That's not that long ago. It's less than a decade. So public reporting is essential. And if you can actually Google this, Leapfrog is a big regulatory body that we report to. And some hospitals don't report on there. I would probably question why. So I know like my son has surgery every couple of years. I check at least the hospital's grade in Leapfrog to see what their hand hygiene rates are, what their colorectal SSI rates are, because those are the ones that are publicly reported, and see how they're doing overall, what their wellness is. And they get an overall grade, but they are made up of many components, with hospital-acquired infections being about 20%. So its public reporting is there. Healthcare has turned into like a consumer market for sure.
For sure.
So and I think that's a great thing. I think if I have so many hospitals around me, I get to choose where I want to go. I'm going to definitely check to see how they're doing. I think Baptist does an amazing job of making everyone feel like they're well taken care of. It's a beautiful facility. But if you want to go a little deeper, you can always Google or, just check us out, see how we're doing.
Okay.
And
then you talked about that. You're talking about you're not only as a infection control nurse, but also as a family member.
Yeah.
How do the families get involved in infection control when we have, these families in the rooms with the patients as well?
Yeah. Education, it's conversation, it's making them part of the team. So we encourage family members to speak up. So, hey, if you saw something that looks a little weird, or you wish maybe they would have washed their hands before, say something. That also goes for them. Make sure that you're washing your hands, that you're not touching things that you probably shouldn't be playing with. If it's an IV pump or if it's a dressing, it's education, and it's ongoing. It doesn't really stop. So we make sure we touch base with family members on our rounds to make sure that they understand what's going on, and to hear what they have to say.
Yeah, because they're around. They got the eyes.
They're around.
They're looking.
And I always recommend to everyone, if you're in the hospital, make sure you have a family member with you, because an extra set of eyes is essential.
Yeah, I agree with that. I always recommend that, because you may not be hearing what the doctor is telling you. You may not be thinking about the questions that need to be asked. So that's always a great piece of advice as well. And so in regard to the hospital cleaning the rooms, we know that there's what we call like a terminal cleaning, where one patient goes out and you have to have some confidence that the hospital is cleaning the room that you're going to now reside in. But what is the hospital doing day to day there? Then what do we do at Baptist to prevent infections of the patients?
So we do some spot checks frequently. A terminal clean is essentially when a patient leaves a room and we got to prepare the room for the next patient to come in. And we do a few things, including bleaching the room, high touch surfaces. So doorknobs, call lights, bed rails, side tables, those get extra attention, not only from the environmental service team, but also the nursing staff who are in there frequently. So high touch areas are addressed very, very frequently. And then the terminal clean, besides cleaning the room sort of from head to toe, they use a UV light, which sort of zaps all the extra lingering bugs. You can't be in the room, the door is shut, and it's about 15 minutes, a UV light goes in there. We do those generally for multi-drug resistant organisms or patients that are on isolation, just to give that room a little bit extra TLC. And then we will sort of mark the environment after to make sure that, or before it's cleaned, to make sure that whatever was supposed to be cleaned was addressed. So we do a little bit of investigating too in the back end, and we spot check.
So you can actually check afterwards to see if the bugs were killed.
Just the environment. So if I know
on the environment.
Exactly. So if I know that your mic is supposed to be cleaned, I'll go ahead and put something that's invisible, and then if they don't clean it, I'll be able to take a black light and see whether that was clean or not.
So that's good to know.
Yep.
That's good to know. Wow. All right. And so what about if there's an outbreak? What do we, what do we do?
So outbreak is, in COVID, we heard this a lot. I was exposed, there was an outbreak. There's a lot of variability in that terminology or with the definition of that. It all depends on the bug. So C. diff is a very clear horizontally transmitted bug because it likes to live on surfaces. So C. diff is a diarrhea microbe that can live on surfaces for up to a year, and it's very transmissible. And so we have had instances where we might see a patient here and a few rooms down, another patient's positive. That maybe, where did that come from? That felt like too much of a coincidence. So there's an art and a science to it. Because you have multiple patients on a unit or in the hospital with the same organism doesn't mean that there's an outbreak. But if you start what we call a line list, our investigation tool, and you start seeing the commonalities, whether you find the smoking gun or not, something happened there. And it's our job to go in there and really tighten things up. So that might be terminally cleaning the entire unit, even if the patients are there. So moving patients out, cleaning out their rooms, putting them back in, making sure that common areas are cleaned. Everyone's using bleach, everyone's hand washing instead of using sanitizer. Those are just some examples of.
Wow, that's incredible. Yeah. And then what about the staff? Because it's very important. C. diff is one of the areas where that can be traveling with staff members.
It sure does.
Traveling with not only, even if they're washing their hands, it could be on the clothes, could be on the clipboards, on the papers, and so forth. So what do we do with the staff?
Also a lot of education and sort of, we'll interview them and just say like, this is what's going on. Can you make sure when you go in there that you can sanitize going in, but when you're coming out, you're doing soap and water. Don't bring anything else that's not necessary. So don't bring a clipboard if you don't have to. Don't bring anything extra in there that you wouldn't want to take out. Lab coats is a huge, I'm working on getting hooks on the outside of the rooms to leave your lab coat out because they harbor a lot of, as you know, bacteria. Mm-hmm. So, less is more in infection control. So the cleaner, the better, but also the less clutter, clothing, anything that will contribute. You don't want just anything following you out of the room. So.
Well, one of the things I heard of, and one of the pieces of clothing that has the most bacteria is ties.
Yeah, they're banned in some places.
Right. So that I'm a bow tie.
You wear bow tie.
I wear bow ties. So that's one of the reasons I went to bow ties probably 20 something years ago.
When do you clean a tie?
Right. So when you lean over, you're not you're not all over the patient, all over the railing, all over, So
stethoscopes are another one, right? So we try and have a designated stethoscope within the patient's room. So if they do have C. diff, we're going to leave the same disposable stethoscope in the room, and then the employees can go in there, clean them before use, but they stay with the patient, so we know they're not traveling from room to room. So there's some equipment we can do that with. And that makes it helpful. That
lab coat, that's going to be very, very interesting.
Yeah.
Wow, incredible. So what are your biggest challenges today? What is the biggest challenge for someone like you and in the infection control world?
I would say, the Hawthorn Effect, which is sort of getting people to do the right thing even when you're not watching. And this includes family members. Like, hey, as we mentioned, this patient, your family member, they're really sick. Hand hygiene, or the Foley catheter, it doesn't need to be there anymore. Right. Let's take it out. Every minute matters. So stressing the importance of, again, less is more. Less devices are better. More hygiene is better. And do that when I'm not there too, because it matters whether I'm there or not. So the Hawthorn Effect, I always like to speak about because it's kind of like when you're driving in the street and a cop comes by you, you might slow down a little bit. Same thing comes with us. We some people in the hospital view us as police, and we're not. We are friends. We are not foes. We are partners, and we're really there just as a reminder of, even if we don't even say anything to you, could there be something that you could have done better, in terms of quality and patient safety.
Right. Well, we're all there for the same purpose. We're all trying to help the patient.
Of course.
And you guys are there to try to help the patient as well. You're trying to prevent a disease.
But sometimes we're busy. And sometimes, it's a hustle in there. So it's really important to just, the reminders of and we're also here to help. So if you have any questions, how can we help you troubleshoot this? And we get interesting questions.
And so you're a resource not only to us as the physicians, but also the nurses. You're a resource to the families as well.
Absolutely.
So, our viewers who are listening to us and watching us, if your family has an infection, you're concerned, ask to speak to the infection control nurse. But you know what, Gabby? The way to prevent infections is to give more antibiotics, right? Right? My mom just needs more antibiotics. That's what she needs. That's why she's getting it. And you know what's better? You can give her antibiotics to prevent an infection. No, doctor, I need antibiotics to prevent an infection. I had those questions when I operate on people all the time.
Yeah.
They aren't you sending me home on antibiotics?
Yeah, no, please
tell
don't.
Tell us about the dangers of the antibiotics. I mean, people don't understand that. That's one conversation I have many times a week with patients because I operate and we give them a dose for the clarity of our viewers. You get a dose of IV antibiotics before surgery. That is the only important dose of antibiotics. It has to be in your bloodstream 30 minutes before surgery.
Yeah.
You get it in the preoperative area. Afterwards, it's not useful and it's detrimental.
It's
Tell us.
detrimental because what we don't talk a lot about, and I'm totally obsessed with this topic, so even offline we can talk about this, but you know, our gut health, you know, our immune system, 80% of our immune system comes from our intestines. And so if you are taking an antibiotic, you're wiping out about 90% of the bad and the good. So people who are perpetually on antibiotics and think that that's going to cover them, it's not. It's actually potentially going to make you sicker, all sorts of other complications. I mean, you can get torn tendons, you can get C. difficile, which you do not want. So also antibiotics, you want to use them sparingly if you absolutely have to. And it is a huge problem. We have at Baptist, we do have a great group of pharmacists called the Antimicrobial Stewardship Pharmacists, and they are our checks and balances. So if you want to use a bazooka to kill an ant, they're going to stop you, and they're going to say, let's use something a little bit more appropriate to do that. And it's a great program because it keeps everything sort of in balance, you know, and stewardship is really, really, it's the future, and it's going to be tough, you know, with urgent cares, and I have a cough, I'm just going to go, and they're going to write you a script, and you got to cough again in 4 weeks, and you know, are you giving your body the chance to heal like it should? And it can through good hygiene and rest and the basics. So.
And what about resistant bacteria?
Ooh, well,
right. So that's what happens. You get these antibiotics that you don't need, and you're just letting the bacteria learn about those antibiotics, and then later on, when you really have an infection, it doesn't work.
It doesn't work.
So what about how bad are those resistant bacteria?
They're real bad because if you don't have if we are out of options to get rid of this bug that you have this bug, and it's only a matter of time that if your immune system isn't ready to kick it, you know, it may not work out in your favor. And we do see that a lot. Even in, I would even say again, urgent cares, they might prescribe a third generation drug that maybe we didn't need, as opposed to a first generation, because we know that there's so much resistance in the community that sometimes we just go straight to the second or third generation without even testing the patient, because we already know it's probably not going to work. And that's also, our food is full of antibiotics. So it's not just coming from taking them, but it's also in our food. So we are, you know, the atmosphere isn't great. So we have to be really mindful as consumers of what we're asking for, because it can backfire.
And what about probiotics? Should they be, if you know, I really had a real infection. I had a tooth infection, a urinary tract infection. I was given antibiotics. Should I be taking probiotics afterwards?
For sure. Absolutely. Probiotics, you know, prebiotics and probiotics, those are incredible tools to rebuild your gut. Even fasting will rebuild your gut. If you do a good 24-hour fast, it's kind of like excavating all the stuff out. I'm actually in the middle of a 40-hour fast right now. And it's incredible. It has real healing effects that can sort of repair some of the damage that maybe those drugs did during that.
All right. So we started with hand washing because hand washing is important.
Essential.
It was essential. We've learned that washing your hands is much better than just a hand sanitizer. The friction.
Friction counts.
Keep singing happy birthday.
20 seconds at least.
20 seconds at least. Keep singing happy birthday. It'll reduce, you know, the bacteria, reduce death as well. And so we wanted to bring attention to that. And obviously we focused on infection control at the hospital. We've learned that, you know, getting out of the hospital is better than being in the hospital when you don't need it. Don't take antibiotics when you don't need them.
That's right.
Right? I think I've summarized some of the important points, right?
I think that's the basics.
Anything else you want our viewers to know?
May 5th is World Hand Hygiene Awareness Day. So it's really a day to look out for. You'll hear a lot of conversation about it if you're paying attention. But hand hygiene is always essential. So don't be obsessive about it, but do it when it matters, and you'll save maybe a life.
I heard, you know, before you eat, after you eat, before and after you go to the restroom. If you've been out in the street a lot.
Do it intermittently, and you'll know. I mean, pay attention. It's worth something being mindful of, for sure. And
I realize it's still a problem worldwide.
It sure is. Hygiene alone.
Just hygiene. I mean, you know, I know food is a problem worldwide because, you know, of all the missionary work and so forth that I do. But I didn't realize hygiene is a huge problem. Just having water and soap is just people just don't have it.
If you don't have it, you're not doing well.
Wow.
That's for sure.
Incredible. Well, thank you. First of all, thank you for coming.
Thank you for having me.
And thank you for obviously everything you do at Baptist Hospital.
Thank you.
And at Baptist Health. So, of course, Dr. Anthony Gonzalez here, reminding you to be healthy, take care of your family, wash your hands, rub them 20 minutes, scrub them,
20
scrub it up,
seconds.
20 minutes, 20 seconds, 20 seconds, and take care of your family because obviously hand hygiene is the first step to being healthy.
Doing so.
Once again, Dr. Anthony Gonzalez from Miami Community Health.